Good morning, everybody. Today marks 247 days, 36 weeks, 8 months later, and here we are. So, sadly, last night we lost two more Albany County residents. We have a woman in her 70s and a man in her 80s. My prayers and my condolences go to both families. And again, it's difficult times when you lose anybody, especially when you lose somebody in these difficult times. So, to the 145 families that lost loved ones since this started, March 13th, now to the 147 total numbers. So, to the two new families, again, our prayers and condolences to you. Today we have 4,260 positive cases of the coronavirus, 1,554 people under mandatory quarantine, as you see that number continues to go up to be the highest. We have a net increase of 71 positive cases overnight. Last time yesterday we had 71 positive cases was May 20th. Today again represents the highest number we've had under mandatory quarantine. Of the new positives for today, we know 33 have had close contact to positive cases, 9 are healthcare workers, 4 people had reported traveling out of state, 25 people don't have a clear source of infection. 18,509 people have now completed quarantine. Of those, 3,753 were positive cases. We have 48 recovery since yesterday. There are currently 35 people in the hospital. 5 more hospitalizations overnight, with a hospitalization rate of 0.82% of those who have tested positive. Yesterday, that rate was at 0.88. Before this week, the last time we had 35 people in the hospital was April the 20th. 8 patients currently in the ICU. Yesterday, the number was 6. So now we're up to 8. Over the last 5 days, there's been an average of 70.8 new positive cases each day, 70.8. Before that, it was 67.6. Our 5-day average of new positive cases has again hit an all-time high. Our numbers continue to go up. When we talk about these numbers in the control room, they're climbing not just here in the state of New York, but all over the country, and we have to continue to watch it. We look at each region's percentage of positive test results reported over the last 3-day period from the governor's office. Tuesday, we had the lowest percentage at 1.2. On Wednesday, we were the third lowest at 2%. But some things I want to keep in mind for everyone. We're 125 miles away from Westchester County. If we all remember where it all started in Westchester, how one person traveled, attorney traveled around and infected a lot of people. So if you look what happened there and what's going on now, just 125 miles south of us, they have an orange zone going on. Their percentage of positive test results Wednesday were 11.34%. So that means when you're in the orange zone that your schools are only remote, and that outdoor dining, you can only have dining outdoors and takeout or delivery, and only 4 people maximum at a table if you go into an orange zone. So these are things we need to think about right down the road. And if you watched 8 months ago, we watched you go from Westchester to Putnam to Ronkonkoma to Orange County, Dutchess County, and it worked its way up here. So it is alarming. These are things we have to watch here as we move forward. Unfortunately, we were hoping that this was going to happen more down the road, but it's here, people. It is here. So one of the things I'll say, certain high-risk, non-essential businesses are going to be closed, like gyms, fitness centers, barbershops, and their hair salons and other personal services. That falls under the different zone categories when you're in it, and hopefully we don't get to that point. And we don't want to get to that point. And that's why Dr. Whalen and I continue to say to everyone, please wear your mask, cough into your arm, clean your hands, socially distance 6 feet. We need your help. We need your help so we don't get to that point again. And the only way we're going to do this if we're all in this together. So I'm saying to everyone, please, please help us help you. One of the things we've talked about, a variety of different things. Listen, we can get through this and we will get through this. But I am urging everyone Everyone that doesn't need to be out, don't go out. Stay home. Stay home. We're at that point, people. Stay home. Only go out if you have to. You want to go to a restaurant, stay outside, socially distance. Do it and go home. Please don't congregate. We don't need people getting together, and we'll get through it. But we're at that point. And if you don't want to go into a red zone, yellow zone, or orange zone, and trust me, it gets a little crazy, the different zones and different requirements, help us help you. And the only way we're going to do this is by you being truthful and telling us, so we can get to 25 people that didn't have a clear source of infection, so we know who they are. And we need people to stop lying to us and help us stop the spread. And the way we can stop the spread too is by just, again, non-essential workers, stay home if you don't have to go out. We changed our work schedule here. One of the things I'm telling to the towns, cities, and villages at our meeting we've been putting out, go to alternate work schedules. If companies can do it, we're telling you, do it now. You want to help us stop the spread? Then go to alternate work schedules, stay home, work from home if you can. Don't necessarily go out in public if you don't have to. I know the last week it was really nice out and people want to be outside. Even like if you see the guidelines from the CDC, the top 10 places, they say state parks, stay away from bathrooms in high traffic areas because the infection rate. It's kind of scary as you start to read down the list of things they tell you where you shouldn't go. Even if you're jogging, be careful of that if you don't have a mask on, especially if it's a road traveled by a lot of people. There's a lot of different requirements out there. Please educate yourself, be smart. And be part of the solution, and we can get through this. Free testing is always available through Whitney Young. If you can't afford it, we'll pay for it. New York State, Governor Cuomo has made all state testing available for free. So you can call the University at Albany at 1-888-364-3065 or Whitney Young, 518-465-4771. And again, you can go to our Albany County website and get the full list of every place possible to get tested. They're out there, but it's here. And saying to everyone out there, please do the right thing for Thanksgiving. Keep it under 10. No one, and I want to assure this because I know we got some Facebook questions, no one wants to go out and fine anyone. We don't want to do this. Don't want to do it at all. We just want people to do the right thing to help us. Because I can assure you, when Dr. Will and I go back and forth and we discuss everything, that's the last thing. We're asking businesses to do the right thing. We're trying to continue to educate people on PPE until we get the vaccine and we get it to everybody and we get through this. It's probably going to be another 6 months. Another 6 months. So please, help us help you. Dr. Willen?
Thank you, County Executive McCoy. I've been consistent with my messaging since day one, so I will refrain from going through the usual what everybody should be doing. You all know what you should be doing. It is a matter of just translating that knowledge into action, and we're still seeing some deficits there, which is allowing COVID to continue to spread through the community. We know that our schools particularly are bracing for what they're going to have to do if we are declared in a yellow or orange zone. And it requires large-scale testing. It requires additional equipment. It requires legal agreements. It requires laboratory capabilities. And most of all, it requires people. And as I said yesterday, our department staff is taxed at their limits. So today, I want to, put out a plea. We have a medical reserve corps. If you are someone who is in the medical field who could donate a little extra time, and that's doctors or nurses, if you are somebody that wants to help the effort, please reach out and let us know. The Medical Reserve Corps is linked on our website. At this point, I can't guarantee you'll get an immediate callback because even that is manpower that we're utilizing currently. But to have your name on a list and to know that we can reach out to you will be helpful. There is a tremendous amount of work that needs to be done. And as we move forward and as numbers increase, there's a tremendous amount of response that needs to be planned, and we need to plan that very quickly in an unprecedented fashion. So I'm asking for the help of the public. We will continue to do the work that we're doing around case investigation, which is the cornerstone case investigation and contact tracing of control. So again, it's important for people to pick up the phone when we call or when you get a call from the state DOH. We need to get information. We need you to be truthful to us, and we need to have you help us help the community. Again, this is not something that my department, the county executive, the governor, anybody can stop on their own without the cooperation and coordination of the general public. So please help yourselves. If you are a parent, help your children. It is important to know that the schools are doing everything that they can to control spread in schools. But they have your kids about 8 hours a day or less. So what happens with those children when they're outside of school is equally, if not more, important. Please make sure that your children are wearing masks when they go out, that they're not attending parties, that you're not hosting parties. I know it's difficult. Again, I speak as a mother as well, and I have 3 teenagers, so those are particularly social people, and it's difficult. It is very difficult, but really we are now at the point where we can look towards the future of a vaccination strategy, and we're better off in that respect than we were in March. But it is more important than it was in March or April for people to double down on the personal control measures.
Thank you, Dr. Whalen. And again, we can get through this working together. And we had a restaurant yesterday. The owner was walking around with no mask on. Workers had no mask on. It's 8 months later, and you sit there and you're like, how hard is it just to wear your mask? And I know we forget, because I've left my office, I think it was last week or the other day, and I get down through the elevator, I'm like, I forgot my mask. And it happens. Even you're trying to make it habit forming. I know it's not comfortable. I know it's hard to cook with it on. But to protect just not your workers, but to protect your patrons, we need everyone in. So please do the right thing. Continue to do it. I also want to kind of switch gears a little bit, remind everyone we have the Toys for Tot at our Albany County hockey facility this Saturday. So that's from 11 a.m. to 4. And Dunkin' Donuts is stepping it up. So if you drop off a toy, you drive through, you don't have to get out of your car. You drop off a toy, and instead of getting a $5 gift card, you're going to get a $10 gift card now from Dunkin' Donuts. So you're going to get a $10 gift card and some munchkins. So well worth it. Please take a drive, drop a toy off, make a difference in someone's life, because it's more difficult now than ever. And I said this the other day, one of the things that broke my heart is little kid wasn't looking for clothes, wasn't looking for the new games, was looking for dishes, a dish to eat food off of, and fork and knife. That breaks your heart. And let's make a difference in someone's life and give them a little light at the end of the tunnel, and make their day happy on Christmas morning. So please, if you have the opportunity, you can afford it, drop it off. If you have an old present that's sitting around that you're not, please drop it off by all means, and make a difference in someone's life. Our mental health support's there. It's available 7 days a week. Please, by all means, utilize the number, call it. I know we get a lot of calls, 8 a.m. to 5 p.m., 518-269-6634. It's there for you. Things are different. The world's different. And it's just not for adults. So I want to clarify this, because a parent said this to me. It's for children too. Children having more of an issue with mental health issues than ever before. Dr. Whalen said it perfectly. Kids are home now. Parents that are homeschooling their kids are doing the right thing, keeping kids away from kids. They're having anxiety attacks. They're having, unfortunately, suicide thoughts. These are things we need to address. Parents, don't do it at nighttime. Have that conversation with your kid during the day. Call our number or get the help that you need right away. It's a huge issue. It's a huge issue that's happened affecting these kids' behavior, because kids want to be kids. They don't get it. They just want to go out and play, and they don't understand why they can't go out and play. They don't understand why they can't go to the playground, or they can't go here, or they go there. Again, it does affect kids, and it doesn't mean just because they're in third grade it's not affecting them. It doesn't mean if they're in kindergarten it's not affecting them. And a high school kid, take that time, parents or guardians, and just talk to your kid and see how they think everything's going, and dive in a little bit. So please, that number is available for children as well as adults. And our 24-hour sexual assault hotline number, 518-447-7716, the 211, and the New York State hotline, as always,